The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. My guest today on Meet the Doctor is plastic surgeon Timothy Katzen, and I'm so excited to talk to you because you have a long-running podcast that I have listened to.
Yay.
And I get to ask you questions about it now.
Cool.
So welcome.
Thanks for watching. And thank you. Thank you for having me.
I had the privilege of meeting Ariel a couple weeks ago through Real Self Connection.
Yeah.
And she had such smart questions. So I'm glad that she made that connection. And now you get to be here with me because this podcast is called Meet the Doctor. And that's all we do is meet doctors.
Okay, cool. Yeah. Ariel's my co-host and my friend and my enemy too, all at the same time.
How is she your enemy?
No, I'm just kidding.
Frenemy, maybe?
We throw it back and forth on the podcast. So it's kind of fun.
It is. The banter is everything.
Yeah.
How did you decide to start podcasting? What inspired that?
I think it's a really good way to provide information to the public. You know, as a professional, we can get the word out there in multiple platforms, videos, infographics, pamphlets, brochures. But the podcast is sort of another dimension where we can orchestrate questions that are very popular. And then when we do our podcasts, we have literally the world chiming in with their questions too. So they can sort of drop in on the conversation and whatever the topic is, either join that topic or sort of branch out and do other topics.
Is that because you're live streaming it?
Yeah.
On YouTube?
Yeah. Multiple platforms. Yeah.
Oh, so it's live. So have you ever had any crazy things happen?
Not yet. Sometimes people go off on tangents, like we'll be talking about silicone removal. And they'll go off on, well, my sister has a scar, and how do we treat the scar? And we're like, okay, we'll get to that, but not too crazy. I mean, we have a couple of filters. We don't answer every single question, right? Because we get thousands of people coming in. But, we answer the relevant questions.
So did it start on YouTube? Is that where the original?
Yeah, it started on YouTube. That was sort of the originator, and then it caught fire, and we kept fanning it, and here we are now.
Have you always been a bit of an early adopter? Is that your style?
I love social media, but social media changes, man, like every month there's something new to go and explore. So it's really exciting. But I think we were very early adopters on sort of broadcasting, like live surgeries and things we do live. It's not necessarily our geography, Beverly Hills, Los Angeles, but more sort of our mindset. We love the audio, we love the visual, we love the creative things that we can do on a digital platform. Plastic surgery is great, but it's also getting the message out there and getting the visual out to people. So I think that's very important for information dissemination. And in a field like plastic surgery, it sort of goes hand in hand.
It does. It's very visual. I think that's why Instagram is such a good medium for us. But
yeah,
then we also sort of forget, and I know this from the data, not just my own experience, that not everyone is on Instagram. We sort of think everybody is, but it's
exactly
only 17% in our primary demographic say it's their go-to for social. They're still like the huge majority is still saying Facebook is the first thing they do. And I've pondered this so much because you always look at your own behavior. What is the first thing I do when I get up in the morning? I look at Facebook first. Still.
Yeah. For me, I wake up, I check my Instagram, and then like about half an hour later, I'll turn my alarm off. So I'm like checking my Instagram before I even wake up.
Yeah.
So that's how plugged in I am to Instagram.
Yeah.
And Facebook was great. Maybe it's still the gorilla in the room, but still, for us in the plastic surgery world, Facebook is very restrictive. You can't post a lot of stuff. A lot of the stuff that we do post on Facebook is not allowed, or if it is allowed, it's taken down pretty quickly. So
Yep.
regardless of what they say or want us to hear, they restrict a lot of plastic surgery information.
But I think what gets missed a lot is that people just want to know you.
Mhm.
And so when you can do something like combine Instagram with a podcast, they have a way to stay connected and in the brief moments, but then they also have a way to know you long form. Someone recently said to me that podcasting is the last human powered channel. Everything else is running with algorithms, and podcasting is still all humans.
Interesting. That's very, very interesting. And that's just for now, May 1st. I can imagine ChatGPT making an avatar for our next podcast. And then the next level, you'll have two AI avatars just chatting to each other.
Yeah, it's happening in the gutters. It's out there. I actually ran into a podcast by accident and I started listening to it. And what they had done was created a bunch of scripts with ChatGPT and then hired someone on Fiverr to read it.
Okay.
So there was a human reading an AI script. And I was like,
Yeah.
this is diabolical.
Yeah. So you basically get the computer to generate the speech, and then you use a human to say what the computer wants you to say. Pretty scary.
So luckily, we are humans and humans still want to talk to us. And we're headed in the right direction with podcasting, I think. And you've been doing it longer than just about anybody in plastic surgery.
Oh, really? That's interesting to know. Yeah.
Yeah.
Yeah. We love podcasts. We love a lot of the audio visual platforms. It's all about creativity and talking about what we do in just various different dimensions. Yeah.
What do people say to you when they come in? How do you know that they're listening?
One of the reasons why we do all this stuff that we do, podcast, YouTube, Instagram, is to get the information out there. So when patients come to the office, they know the majority of what I have to say. So we don't have to repeat a lot of the stuff. And, when I do start repeating, what the surgery is going to be, how it's going to go, they're like, yeah, we watched all your videos. And I'm like, wow, great. Great for me that they have the information. Great for them that they have the information. And also saves me a lot of time.
Yeah.
Yeah.
And probably some of your mental health, I would imagine.
True. Instead of repeating over and over and over. Yeah. And it's good too on a visual platform. You can sort of, wherever you are, healing up, jump on my page or my YouTube and go, okay, how do I take care of the incision? Or how do I take care of the drain? Or how do I do this? As opposed to 2 a.m. in the morning calling Dr. Katzen, how do I do that again?
Right.
So it's very educational. Yeah.
Yeah. That's a big deal because it's you. I have a slide somewhere that shows how important it is that it's actually you compared to
Mhm.
general or generic information that was written by anybody. You're their doctor and they want to hear it from you.
Yeah.
Yeah.
True.
What kinds of things are you known for surgically or non-surgically?
Yeah, I do two main things. One main field is plastic surgery, or what I call reconstructive surgery, because that's really what it is, after massive weight loss. Now, when we say massive weight loss, I mean like 100 pounds or more. So we've had a couple of patients, that have lost at least 600, 700, even 800 pounds. Okay.
Wow.
And after that massive weight loss, we do all kinds of things like tummy tucks and extended tummy tucks and body lifts where it goes all the way around the tummy, hips, and backside. We do thigh lifts from groin to knee a lot of the time, sometimes groin to the ankle. And then we do all kinds of breast procedures, male and female, lifting and augmenting and back lifts, getting rid of excess skin on the back. Do a lot of arm lifts, armpit to the elbow, and sometimes elbow to the wrist. And then all kinds of face lifts because that's an area that's often affected after massive weight loss. So that's about half of what I do. I'd say maybe 70% of what I do. And the other 70% of what I do is silicone removal. Okay. And it happened maybe about 10, 15 years ago when I had a patient I did a tummy tuck on. She'd lost a lot of weight. She turned out great. And then she's like, Dr. Katzen, can you help me with my butt? I'm like, butt? What's wrong with your butt? She goes, well, I had silicone injected into my butt. I'm like, it's silicone injected into your butt. Why'd you do that? Well, it's sort of black market, and I had a friend do it, and we did it in a hotel room, and it's all infected now, and it really hurts, and I have sciatica, and you got to get it out. I'm like, all right. So I made the incision across the top of her buttock, cleaned it all out. She basically was cured. All her pain went away, sciatic went away, and she was really, really happy. And then a couple of months later, she goes, I'm so happy with this. Can I refer my daughters, three of her daughters,
They did it too.
and her sister, and her grandma?
They all did it.
And so I did that cluster of patients, about 7 in one immediate family. And now I do silicone removal all day long. Did one this morning.
Oh, how sad.
That's how much. And the problem with silicone removal is it's not just the butt. People are injecting the buttock and the breast and the face and the inguinal, the groin region, male and female. And then to make matters worse, the stuff spreads. So we had a lady from Louisiana. She was a nurse. During her 3rd injection, she had injections into her buttock. She could feel it going from her buttock into her ankles.
Through her femoral artery or like through a vein?
No, probably went in the lymphatics and spread down. So basically, she had her butt injected, and now I'm doing ankle surgery to get rid of this. It's cement pretty much in her ankles. And we have a lot of transgender patients who have had their breasts injected. So now we've operated on patients from places like England and Scotland and Dubai and Qatar and Israel and China and Australia and all over the Philippines, all over Central America and South America, all over the US, not just California thing for this silicone business. It's a mess. Also Germany and Japan. So crazy.
And does it all kind of happen the same way, like in a hotel room?
Yeah, typically, yeah. I always ask my patients, so how did you have your silicone injected? And the most common story is a friend of a friend, usually in a hotel room or somebody's house kind of thing. But, bizarre stories. It's rarely a doctor, honestly. It's probably less than 1% of the time a doctor. Sometimes it is, but usually they're a doctor from another country in the US illegally injecting this stuff.
Do you feel like it's increasing or decreasing? Are people more aware that this is a bad idea now than they have been in the past?
I think they're more aware, but I know every single day there are people getting injected in Los Angeles. There's a dermatologist that advertises silicone injection 1 block away from me. There's an ICU intensivist that advertises silicone injection about 20 minutes away from me. It's crazy. People are still doing it every single day. Ariel and I were doing a live surgery once and silicone removal for the buttock. And the buttock is wide open. There's blood and guts and everything, not guts, but silicone and all kinds of things spilling around. And people were like, oh my gosh, what's going on? But one viewer was like, wow, her buttock looked really good. Do you have the name and the number of who injected her? Because I want to get my butt injected. And Ariel and I were like, whoosh, message not received.
Wow.
It went completely over that person's head.
Oh.
So, you got to be careful when we're, disseminating this information that it doesn't get sort of misinterpreted into, oh, I want that kind of thing. So we try, but sometimes people are still doing it every single day.
I know a board-certified plastic surgeon on the East Coast who still defends it. So is there a difference between the stuff you're taking out, and is there some kind of safe and legitimate silicone that you can use?
There is silicone, but it's meant for the eyeball, for a really rare eyeball surgery. But that's it. You can look at the US FDA, our government, and it does not recommend silicone for large volume augmentations. So there it is by our government.
It seems like we have enough alternatives that work just fine that are safe, that you don't need to.
Exactly. It's not worth it. I mean, people do die from these silicone injections during the injection period. It can embolize, it can go into the vein, wind up in your lungs. It can go in the artery and embolize distally. It can then spread throughout your body. And then you have these products in there, these silicone that's not you. And it develops these autoimmune problems. So we have patients who have rheumatoid arthritis, Hashimoto's thyroiditis, ulcerative colitis, all these autoimmune problems because of the silicone, sarcoidosis. And then we have about 12 patients young patients in their 20s, early 30s, who had the silicone in there. It develops scar tissue. The scar tissue is made of calcium. The calcium is obtained from your bones. The calcium goes in transition from your bones through your bloodstream to make the scar tissue. And during that transition, it goes through your kidneys and makes horrific kidney stones. After a while, the kidney stones get so bad, they cause kidney failure, and you need a kidney transplant in your mid-20s.
That's horrifying.
We have a paper coming out soon of the collection of those patients. People have no idea, and the doctors have no idea. Some patients have connected the dots between silicone and kidney failure, but not too many.
That is horrifying. And so you're publishing. You just said you wrote a paper. Is that part of your ongoing work?
Yeah, we're so busy, operating, trying to get rid of this stuff. Yeah, we'd like more doctors to know about it. A lot of doctors, when we ordered the MRIs, they're like, "What are you looking for?" And I'm like, "Silicone." "You mean like silicone implants?" I'm like, "No, like raw silicone." And the radiologists are like, "Why would people do that?" I'm like, "I don't know. I'm just ordering the tests. I'm just telling you what to look for." So they're sort of amazed at what people are doing out there. They're sort of disconnected.
And so your patients are coming from all over the place. So they're seeing a radiologist locally before they come to see you. You're getting films and stuff.
Yeah, so we do virtual consultations, Zoom, Skype, WhatsApp, FaceTime, et cetera, all over the world. And then we order an MRI locally to figure out what's going on. And, we have all kinds of Google Translate and translating kind of things going on. But usually we're able to figure out how much product is in there and where the product is. Is it in the fat? Is it in the muscle? Has it spread? Yeah.
So you have Ariel. Who else helps you in the office? What does your team look like?
Yeah, so we have two office managers, Jane and Jessica, and they sort of oversee the entire office. Then we have Ariel, social media, and then we have Anna, who's our front desk receptionist. And then we have one of my daughters who does a lot of photo and video editing. And then my wife, too, who does all the tough stuff, the accounting and the billing and the processing, everything. Yeah,
Yes, she keeps the doors open.
correct.
So that you're the only medical provider, or do you have?
Correct.
Oh,
Correct. Correct.
okay. That's an interesting setup. Actually, in Beverly Hills, it sounds kind of similar to other organizations that I've heard of. And you're all kind of super specialized there.
Yeah, and I think that's a really important thing for Beverly Hills and Los Angeles. I mean, especially in Beverly Hills, you can't say you're great at everything.
Good luck with that.
Exactly. So in Beverly Hills, I learned pretty early on it's better to just get super subspecialized in one area. And the area that I love is basically plastic surgery or reconstructive surgery after massive weight loss.
Yeah.
And then sort of this other thing, this silicone removal thing, just came at me because we had a couple of patients.
Yeah.
And now it's just huge.
So that's the other boom, the weight loss boom. And,
Yeah.
and certainly is accelerating. I think we're all aware that it's accelerating because of the GLP-1 medications. So
Absolutely.
in the old days, like you've been doing this longer than GLP-1s have been around, you're seeing people who had bariatric surgery come through.
Correct.
And was anyone losing weight without surgical intervention at that sort of larger volume?
Not like 100 pounds plus. People would be on the phentermine and the HCG injections, those things. They would lose some weight, maybe 50, 60 pounds at the most, but not 100 plus pounds like the bariatric surgeries. So the bariatric surgeries would be the Roux-en-Ys, the lap bands, the vertical sleeves, now duodenal switch, et cetera.
How have you seen the landscape change in the last year then? What's happening?
Yeah, so that's very interesting. So I've seen less of the bariatric surgeries, and that's probably a number people should look at least in the US and globally. I bet you those numbers are going down a little bit because everybody and their brother are doing Ozempic and Zepbound and things like that, Manjaro, et cetera. Because look, they really work. They decrease cravings, they decrease appetites, decrease GI motility, and the side effects are there. There's some. And there's some people who don't qualify, but it's pretty small.
When you see somebody who's lost more than 100 pounds, can you, I hate to say fix them, but can you turn that around? I think where I'm going with this is if you lose more weight than 100, do you have to start doing surgery in stages? Is that a process that you have to go through?
Typically, yes. So usually when you lose 100 pounds, almost your entire body is affected. When you lose 100 pounds, it's not just like, oh, my tummy has a little excess skin. I might need like a mini tummy tuck. No, you lose 100 pounds everywhere: your arms, your breast, your tummy, your buttocks, your inner thighs, even the face.
Even your head.
Yeah, absolutely.
I know this from personal experience.
The shrinking head. Yeah.
I put on a hat after not wearing it for a year, and I was like, what happened to my hat? And I had to bring it down 4 notches.
Yeah. That's good.
Which I didn't think was possible that you could lose weight on your skull, but you can.
Yep. The fat around the perimeter. So, yeah. So when we see a patient for massive weight loss, a lot of the body parts are affected. So usually we stage these areas. Usually it's lower body. So that could entail that body lift, tummy, hips, and backside and buttock, combined usually with the thigh lift, groin to the knee. Usually we combine those. Stage 2, a couple of months later, would be upper body, and typically that's arms and breast, maybe the back. And then third stage, maybe if the patient wants it, would be the face. Facelift, neck lift, maybe some fillers.
Do you feel like most people want to deal with their body before their face?
In my weight loss population, yes. Yes. They're younger crowds typically, and they usually want their body done first. Typically, the most common procedure that we do is usually the tummy, male and female. And then females prefer to do the backside and the lower extremities. Men don't really have too many issues with the arms, but they're focused on the chest more often.
Let's talk about arms for a second, because that surgery in particular, if a surgeon doesn't do it often, it can turn into not such a great result, because it's anything that you don't do every day, you wouldn't be good at. That's just sort of common sense, right?
Correct.
And
Correct.
it also can be a pretty ugly scar if you don't get it done right. So how many arms do you do in a year? Like, I would say you're probably an expert at arms at this point.
Yeah, I think like anything, the proof is in the pictures, let's say. So I think, when you see a plastic surgeon and they say, oh, yeah, I do it all the time. And yeah, I do 10 of these a day. Well, that's nice. Show me the pictures. So on our website, I think we have like 130 different arm lifts. So I challenge our patients to, if you find anybody on the entire internet, the globe, that has more arm lift pictures than I do, let me know and we'll give you a special deal. Because I don't think there's anybody out there.
I think I calculated once that if you saw 100 pictures, it meant they'd probably done 1,000 cases. Don't ask me how I got to that. I was doing a bunch of math to figure it out.
And that's probably pretty accurate, because some patients, don't want their pictures up. And sometimes we can't get the before and after pictures together because maybe it was on this computer or that computer. Or, I still remember taking like slide pictures of patients. So it's not like we're going to scan the slide and that's going to be there before. So some patients are lost in the fray. So in terms of the pictures, but yeah, so proof is in the pictures. And then also we do a lot of body lifts. I don't think anybody on the internet has more body lift before and after pictures that we do. I think we have at least 100. So yeah, we do a lot of body lifts too. So for patients that are looking for plastic surgeons, I think probably the best thing to do is see how many before and after pictures they have. If they don't have too many, they probably don't do too many of that procedure.
It's good advice.
Yeah. So in the arms are very important. I love doing arm surgery. We did a couple last week. The incision typically goes from weight loss patients from the armpit to the elbow. But look, I saw a patient yesterday. She had lost a lot of weight, and she's concerned more about her forearms than her upper arms. So on her, we're going to make the incision from the elbow to the wrist. So, it just sort of depends what bothers you the most.
Your gallery is also organized really nicely in the sense that we're all looking for photos of people that look like ourselves. And so instead of being super specific, I like that you're giving these ranges like between this weight and this weight and this between this height and this height, because you can kind of hone in on a group instead of looking for like the exact person that looks just like you.
Exactly. And I stumbled across that, oh boy, maybe about 20 years ago in the weight loss patients.
Hmm.
I had multiple patients come in. They're like, Dr. Katzen, I lost 100 pounds or I lost 200 pounds. You've never seen a body like mine. And I'm like, yep, I bet you I have. And then they show me their body. And then, like, I'm thinking, okay, you look exactly like so and so. Go to my gallery. And they're like, this is a patient that looked just like you. And this is her results. And the patients were like, wow. So for me, weight loss patients, they lose their weight in all different ways and shapes and sizes. Even more reason to have a big word, plethora of patients out there to sort of show patients, yep, I've seen a patient like you, so they can identify with a picture and go, that's what I want. And yes, Dr. Katzen, you've seen one of those before, so I can anticipate a result like X.
That's so important.
Yeah, I think so. I think so. Makes sense.
I always wanted to add a button to the gallery that said, ask the doctor about this case, or like a button that said, this one looks like me, so that you could send it in and say something specific about it. We got close here and there. Like we were able to heart cases and like them and
Yeah,
save the case numbers, things like that, that make it easier for people to just communicate well about what they want.
yeah. Now people just take screenshots
Yeah,
and just send it. Oh, I want
that's
this. I'm like,
true.
oh, okay, we can do that. Yeah,
Yeah.
yeah.
Yep, the old screenshot, that works too.
Yeah. Yeah. Yeah, I think it's really important for, the public when they're looking for something, because everyone's going to say they're the best at everything. That's just the common nature of probably humans. But with plastic surgeons, I think if you can find somebody that really specializes in your area, that has lots of pictures before and afters, that should be a primary indicator to somebody that's doing research that that person does a lot of those procedures. And in this day and age, 2024, you shouldn't be afraid of traveling for medical specialists. Before, maybe even pre-COVID, people weren't traveling that much for medical procedures or surgical procedures. But now the world is wide open, and we've got a lot of international patients coming in, a lot of out-of-state patients. I would say for me, probably about 30% of my patients are local around LA. Okay. The rest, 70% are outside the state. And about half of that 70% are from outside the country. And it's just either my super specialty or or it's the internet and the way we propagate, promote our practice.
How do you help those people who are traveling have a comfortable experience when they're there for a short period of time?
Yeah, Ariel has great suggestions for restaurants. That's number one.
Number one.
Yeah, number one. We have some hotels we work with that are like 10 minutes from the office who give us corporate rates. We have some really good recovery centers that really cater to patients. And I think our patients, really like staying in LA. I mean, LA, there's so much to do. There are two types of patients we get: patients that come in the day before surgery. They have the surgery, they recover, and the minute they're ready to leave, they're out of LA. Or we have some patients that come in like a week or 2 weeks ahead with their children, and they go and check out Disneyland and Universal Studios, Legoland, things like that, and then have the surgery and then proceed accordingly. Yeah.
Yeah, it's not a bad place to visit, especially if you live somewhere cold or boring.
Yeah. There's lots to do here. Traffic sucks, but the weather you can't beat.
It really only sucks if you live there. If you don't live there, you're just like, oh, well, it's not that bad.
Yeah. Yeah.
Yeah.
True.
Well, it's been really nice getting to know you. I love what you're working on, and I love that you're not afraid to solve big problems because both of your super specialties are very unique. The kind of patient that you help is a really specific kind of person, and they're not just looking for bigger breasts or they're trying to recover or heal from something or change.
Yeah.
That's a nice space to occupy.
Thank you. And thank you very much for having me. I was very excited when Ariel told me. So thank you very much.
Anytime. If we're listening today, we want to find out more about you. Where do you suggest we look first?
Couple of ways. You can Google up my name, Timothy, Timothy, Katzen, Katzen, or you can old school call us, 310-859-7770. We're all over the internet, YouTube, Instagram, Facebook. Those are our favorite platforms. We do some Twitter, we do some LinkedIn, but join our podcast too. Watch us answer questions pretty much every Tuesday, Taco Tuesday, we call it. And we get all kinds of questions and we get you all answered up.
Taco Tuesday. I'll make sure I put all those links in the show notes, including the passenger pigeon and the soup can telephone.
Okay, cool. Thank you.
Thanks, Dr. Katzen. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.